Affectionately referred to as the Pearl of Africa because of its vast natural beauty, Uganda also happens to be strategically located at the heart of the continent. With a population of some 35 million people, its economy has remained one of the most thriving and fast-growing throughout the past 25 years. Uganda is experiencing rapid growth in the ICT sector, and this is being facilitated by the presence of a stable regulatory environment put in place by the Uganda Communications Commission, UCC. Under its aegis, policies and regulations have been put in place to optimally develop the communications sector and to adapt it to the needs of the populace. UCC has been at the vanguard when it comes to fostering linkages and aiding innovations to ensure communications for all. In Uganda today, mobile network coverage stands at 98%, teledensity at 46.5%, and internet penetration at 14%. Uganda also faces a multitude of challenges when it comes to health service delivery. The Ministry of Health quickly realized the critical role ICT could play and set up a technical committee which is in the final stages of putting in place a clear e-health policy and strategic framework.
The telecommunications industry is entering a new level of entrepreneurship, one which is moving to improve people's lives.
Kubanga nze newe mba sinaba kumanya nti sawa etuuse y'okumira eddagala ngenda okuyanga ku simu yange messages era message wejjira nzija eddagala lyange ngamira.
Been receiving messages from text to change about antenatal, where to go and get my antenatals, how often I should get them, what immunization shots I need to take, which have been very helpful.
As a result of this enabling environment, Uganda is now home to a multitude of e-health initiatives. Here we showcase a few. One of the oldest was the Uganda Health Information Network. A multi-partner collaboration, it sought to improve clinicians' access to reliable, timely and relevant information while allowing for the improved flow of data vital to health service delivery.
In the past, health centers used traditional paper and pen to alert district officials and national distributors that drugs have run out. This was time-consuming and inefficient, leading to delays and errors. As a result, significant bottlenecks were created in the drug supply chain. Due to the unprecedented access to mobile phones, technology is being used to create a seamless system of health management. In partnership with DFID and WHO, M-Track is one system which utilizes SMS to allow health workers to report on obstacles they face in real time. M-Track also offers an anonymous SMS hotline that the public can use to text in their complaints.
UHIN served as an eye-opener by revealing the necessity for technology that is adaptable. This would in turn guarantee functionality and thus meet the needs of the end users. The early and sustained government participation in UHIN enabled easy integration of the initiative into existing health frameworks, a critical factor in ensuring sustainability of e-health programs.
Traditionally, the sources of information were libraries, well-resourced health centers, which are not available these days for many reasons. Now, PDAs are what they use as end users.
The objective of the project is to improve data collection processes for health management information system. The second objective is to send health information for better health management of the patients here from Kampala to the health workers.
Most of them in the field do not have books to read. They don't get journals, they can't get new information, but as soon as we get it, we send it to them. So they have improved their care in terms of their clinical ability as well as their knowledge.
If I have the PDA there, I just check and see what to do.
At first, it was hard to me, but with time, I was trained by my colleagues and got the tips of how to use it, but now I am no longer getting problems.
And this data would be synchronized according to the schedule.
Our AAP is configured with the desktop. There are addresses within the desktop which are connected to Uganda Chartered Health Net.
I just scroll here, I look for an icon called Documents to Go. Then it brings my list of files.
Win Senga. Senga means paternal aunt in one of the local dialects, and traditionally the Senga plays a major role in guiding a girl into womanhood. A brainchild of university students, Win Senga is a mobile application that provides improved functionality to the traditional pinard horn. Today, health workers use the horn to listen to fetal sounds and then make a diagnosis on the status of the unborn child based on the type and strength of the sounds they get. But such a method does not guarantee accurate or adequate information. By modifying the horn and attaching it to a smartphone with the application, data on the location and condition of the fetus is displayed. This information can be used by both the mothers and healthcare professionals. WinSenga is an example of how existing technologies can be enhanced to tackle day-to-day problems. Text to Change and Kawempe Home Care. Funded by USAID and implemented by the community-based Kawempe Home Care, KHC, this project showed that the use of text messaging is a viable tool in helping patients adhere to their antiretroviral therapy. The study observed a 7% increase in adherence and 15% increase in the percentage of patients with acceptable adherence levels, that is to say, adherence above 95%.
UCC, with the development partners from the University of Karolinska, developed a software, ICT4, which we use to register, record our patients, get the information regarding their biodata, their complaints, those are the signs and symptoms. ICT4, which we use to register, record our patients, get the information regarding their biodata, their complaints, those are the signs and symptoms. The good thing with the system is that it automatically balances the stocks you put in. For every number of tablets you give, it will always tell you, to give you feedback on how much stock is left. And it has always a warning system to show you that you are running out of stocks for essential items. I can happily say that since the system came, I think we are now more organized than we were before.
MTRAC. This is a Government of Uganda initiative in partnership with UNICEF and funded by UK aid from the Department of International Development, DFID. MTRAC is an SMS-based data collection tool that creates a reliable flow of information between district health facilities and national distributors by allowing workers at district health centers to track incoming and outgoing medications and monitor case management data via mobile phones. This eliminates errors which accrue from the traditional pen and paper data collection method. U-Report, a complementary SMS-based tool, enables significant community participation, which provides an independent verification channel and plays a vital role in curbing practices such as absenteeism and drug theft.
MTRAC has done a lot of good, because before there was no platform where the community engages with the service provider. So it has also created more awareness of the community of their rights. It has also helped to link the community with the government service providers. It has helped to create accountability.
Now, when we go together with Text to Change in this project, we wanted to look at the impact and the benefit of extra support to the community network to help our patients, and it has really been fantastic for HIV patients, and we are looking forward to beginning it for tuberculosis control and for the aspects of our program.
ICT for Empower. UCC, in conjunction with the Ministry of Health and Karolinska University Hospital, are facilitating the digitization of rural health service units in Uganda. Through ICT for Empower, they are piloting the development of applications that are expected to enable electronic patient record management and establish electronic referral, teleconsulting and feedback, and stock management systems. Through ICT for Empower, they are piloting the development of applications that are expected to enable electronic patient record management and establish electronic referral, teleconsulting and feedback, and stock management systems. Although these are only a sample of the e-health initiatives being undertaken in Uganda, they give an insight into how ICTs can significantly contribute to improvement of the health service delivery. The Uganda Communications Commission will continue to play its part as a regulator and facilitator of ICT innovation in Uganda.